Hi, my name is Dr. Lexie Wang, and I'm a facial plastic surgeon at West End Plastic Surgery in Washington, D.C. Today on this episode of Face to Facts, Nose Edition, we're going to be talking about Alarplasty, or anything to do with modification of the alar base or the lower part of the nose. So the alar base is technically defined as the region from the end of this ala to the end of this ala, aka from here to here. And there may be a few reasons we want to modify this. Oftentimes it's being modified because it is too wide, as in you either have too much flare of your nostrils, so they're kind of too rounded as opposed to they should be straight. Or it might be that you have really wide nostril apertures, or whatever reason it might be. The base itself, technically, when you look back, should be behind the medial canthus of your eyes. If it's a little bit wider than that, then usually you're considered a little bit wide. And so that would be grounds for attempting to do a little bit of a narrowing, such as doing any kind of alar base excision. There is also the ability to do an alar base expansion, although it's not commonly done, only because almost always that is a revision type of situation where someone had overly aggressive resection of a previous alarplasty, and now, for example, like they can't breathe or something like that, so now we actually have to open them back up because it's been over shortened. So this is a really great little procedure for people who might not be totally ready to dive in and do a total big rhinoplasty, although you do have to be aware of the limitations of this and that it pretty much only changes this, won't touch anything else. It can even be done with just local anesthetic alone, although I think a lot of people choose to still go to sleep for it. And it's a really great procedure. I think patients are very happy with the results. One thing I will say about it is that people are always very scared about the scars related to this, and almost always they heal really nicely, especially if you're getting good post-op care by your surgeon. Although there is no 100% guarantee as always with plastic surgery, but I would not worry too much about the scars in this area. So this is me again. I'm Dr. Lexie Wang. I'm a facial plastic surgeon in Washington, D.C. Those are my thoughts on alarplasty. We'll see you next time for Face to Facts.